Skylar. This is the third video on pin and stretch, just another little supplemental to the blog. I just want to give you a little peek behind what people are doing when you look at YouTube videos. A lot of times they're using bands like the one I have around my knee right now, and using foam rollers. All they're doing with these, 99% of the time, is pin and stretch. So just like I described how to do this with your hands, some places are harder to reach, so you use a tool or prop like this. So on my leg, I've got a band that I just put on a compressive sleeve, and I put something between it to really isolate. Right now I just have an added compression on the vastus lateralis of my knee. So if I put this on in a short position, and then I lengthen the tissue, well, now I'm doing some pin and stretch, okay? You oftentimes see people do the same thing with foam rollers in videos that you see online. If I was working off a foam roller on the quad, I find an area I'm interested in, it's kind of tender there, and then I stretch through it. I effectively use my body weight to create a pin and a stretch. Your random anatomy of the day is going to be on the patella. So, this patella is a kind of oval-shaped bone that rests between two condyles in your femur. You have a medial condyle that's good and steep, a lateral condyle that's not quite as steep. Because of this reason, if someone has instability in their patella, and if they're ever going to dislocate, it's usually going to go laterally. You want to make sure that you have good range of motion in that patella. If you ever have any issues, pain in this area, it's a good idea to sit and just kind of work lateral to medial, moving that patella toward yourself. You can do that 30 seconds a day. Helps with that range of motion, helps with the stability. Make sure that it stays medial rather than lateral.